Good evening, everyone, and welcome to this second webinar in the research webinar series that is put on by the Canadian Coalition for Homeopathy. We're very happy to have you here this evening for what is sure to be a very exciting and engaging presentation with Dr. Jennifer Jacobs. And my name is Victor, and I'm just going to say a few words about the Canadian Coalition for Homeopathy. Um, So for those of you who are unfamiliar, the Canadian Coalition for Homeopathy is a national organization whose core mission is to bring together patient associations, homeopathic practitioners, um, patients of homeopathy, researchers, those involved in manufacturing of homeopathic medicines, and the general public to help to provide a forum as well as a cohesive organization that promotes and educates about homeopathic medicine, its potential, and its future, and tries to ensure it's this strong and sustainable and robust future for homeopathy in Canada. And so part of that effort is actually this research webinar series, which Dr. Ayubzadeh will discuss momentarily. But before we talk specifically about the webinars, I just want to show you our website where you can get in contact with us should you have any questions. You can find a growing body of articles and research. The website is homeopathycoalition.ca. We have also a mailing list that we have recently started. And if you join the mailing list, you will be kept up to date about future webinars and related events that the coalition is involved with. And for those of you, and there have been some questions online about recordings of the webinars. And yes, if you go to articles and research on the website, you will see that all of the webinars will be posted here. And the first webinar presentation, it's right here. It's loading, unlocking the healing potential of homeopathy, debunking the placebo myth, which is all about the notion of placebo and homeopathy by Dr. Ayubzadeh, and it is available for you to watch. And we do encourage everyone to watch the previous installments of the webinar series because they will all inform each other and eventually develop, contain a very cohesive body of perspectives on homeopathic research that can be used again to inform the general public, but also for by practitioners to help develop an understanding for their patients and for their colleagues in allied health professions to develop a more robust and clear understanding of the really amazing research that is and has taken place in the realm of homeopathy. Um, and so what I will say is that we do have several other webinars that are scheduled, and I will just briefly mention those for your interest. So you can see that our next webinar is on November 20th with Arya Mohan, and the topic is still to be determined, so stay tuned for that. And then in January, we have a presentation by Leonardo Fedo from Brazil, who is going to be speaking about agrohomeopathy and pathways for sustainable food production. And the topic of homeopathy in agriculture is very exciting and ever growing. And then in March, we have Dr. Ronald Whitmont, who is speaking about homeopathy and pain and research in that area. So if you would like to sign up for any of these webinars, the easiest way to stay informed when the registration opens is to join our mailing list, which you can do via our website at homeopathycoalition.ca. And all of the links will be sent directly to your mailbox, or you can go to our social media pages or check our website because it will be posted in all of those places. And lastly, we do accept donations to help keep the coalition running. And the link to donate is also on our website. So if you appreciate the work that we're doing, please do feel free to donate whatever you can to help support the Canadian Coalition and the mission of creating a sustainable and rigorous future for homeopathy in Canada. And so, with that said, Sharem, if you'd like to tell the listeners a little bit more about the objectives behind the research webinar series.
Thank you, Victor. Hello, everyone. I've been practicing classical homeopathy for close to 35 years now. Every single day, I see patients who have done everything that conventional medicine can do for them without much help. They have even tried many different other modalities with some benefit. But when they come for a consultation and we do a very thorough homeopathic consultation and prescribe a remedy, and I'll see the result, the patients see the results, and invariably, the vast majority of these patients, they say, I have never felt this good. I hear that day after day, and I say, why don't most more people know about homeopathy? There's so many people around the world that have healed miraculously, really, from homeopathy, yet the world doesn't know about homeopathy. That's why we decided a few months ago to debunk the biggest myth that exists in the mind of people, that homeopathy, because it's highly diluted, is just a placebo. There is really no research behind homeopathy. And those of us who practice it experience how amazing homeopathy is day in and out. And those people who have never experienced it, they still believe that if homeopathy was more scientific, it would be more accepted and it would be practiced in hospital. And we love to show that homeopathy is scientific. There are researchers behind homeopathy, very solid researchers. And that's why we decided to have this webinar. In the very first webinar, very briefly, I talked about the placebo. I think it's very important for any practitioner to know placebo and how to recognize the placebo response versus a homeopathic or healing response. If you do have time, please watch that video. I have showed also how, through some examples, when you question whether it was a placebo response or not, what you can do as a practitioner or as a patient to find out whether your reaction to a remedy is a placebo or is it a true homeopathic healing. So it is my hope that through this series of webinars over the next year, that we can show to the public, and we want to really encourage all of you. If you're a homeopath, please share these webinars, links to these webinars to all your patients. And if you're a patient or friend of homeopathy, please spread this to everybody that you know to make the public to become more and more aware that homeopathy is really scientific and there is research behind it. Thank you very much. And I'll pass the floor to Liz to introduce Jennifer to us.
Thank you, Sharem. Hi, everyone. My name is Liz Chapman. I'm with Canadians for Homeopathy, and we are part of the coalition. It's my pleasure to introduce our guest tonight, Dr. Jennifer Jacobs. Jennifer is a retired family practice physician who specialized in homeopathic medicine. She was a clinical assistant professor in epidemiology at the University of Washington School of Public Health and Community Medicine. She received her MD degree from Wayne State University and a master's in public health at the University of Washington. Jennifer is a former president of the American Institute of Homeopathy, co-founded the special interest group of the American Public Health Association on complementary and alternative health practices, and served on the advisory board of the NIH Office of Alternative Medicine. She has published groundbreaking homeopathic research in peer-reviewed medical journals and is the co-author of Healing with Homeopathy, published by Warner Books in 1996. Now retired from medical practice, Dr. Jacobs' book, Do You Really Need That Pill?, was published in 2018 by Skyhorse Publishing. And the topic that Jennifer will be addressing tonight is clinical research in homeopathic medicine. Welcome, Jennifer.
Thank you, Liz. Let me share my screen. Okay, is that up and running?
Yes.
Okay, great. So yes, I'm going to be talking today on the subject of clinical research in homeopathic medicine. I'd like to start out by talking about the fact that homeopathy is the number two, the second most widely used complementary and alternative modality in the world after Chinese traditional medicine. It's estimated that there's 500 million users worldwide. Uh, France is the place where homeopathy is widely used. About a third of all people and physicians use homeopathy in France, and most all pharmacies there sell homeopathic remedies over the counter. In Great Britain, it used to be covered by the National Health Insurance, but because of political changes and anti-homeopathy groups, it's no longer part of the National Health Plan, but the royal family has used it since 1830. And Queen Elizabeth, up until her death, had a homeopathic physician that took care of her, and we like to think that's why she lived so long. In other parts of the world, homeopathy is very, very popular in India. Uh, there's over 120 medical schools that teach homeopathy, and it's estimated that at least half of the population there uses homeopathy. I will say also that homeopathic research is very strong in India, and some of the most important research studies recently have come out of India. Homeopathy is also very widely practiced in Latin America, especially Brazil and Argentina, as well as Mexico. In the United States, the most recent information we had was over 10 years ago, which estimated that 2% of the US population used homeopathy. And most of it was done over the counter for self-care, combination homeopathic remedies that people take themselves for colds and flus, and arnica, of course, for injuries. But more recently, we think the numbers have grown quite a bit because the homeopathic pharmaceutical industry has experienced quite an increase in sales. So homeopathy is based on the principle of similars. I'm sure many of you are familiar with this. That is a substance that can cause certain symptoms when given to a healthy person, can cure those same symptoms when given in small doses to someone who's already sick. So the principle of similars dictates that in homeopathy, as opposed to allopathic medicine, the medicine is chosen based on the symptoms that the defense mechanism of the patient is producing, not on the category of illness. It's a holistic mind-body approach that looks at the totality of symptoms on the physical, emotional, and mental levels. And because of this, as it says here, the medicine is prescribed individually for the person, so that 3 people that all have the flu might get 3 different homeopathic medicines because the symptoms that their body produces in response to the illness are different, and that's why it's considered individualized. So homeopathic medicines are prepared by a process of serial dilution and shaking. And this is really the reason homeopathy is so controversial, is that the medicines are so highly diluted that according to these principles of chemistry and physics, there's likely no more molecules of the substance left. And this is, I'm referring, of course, to Avogadro's law, which says that the number of particles in 1 mole of pure substance is 6 times 10 to the minus 23rd power. So it's extremely likely that dilutions beyond 10 to the minus 23rd power contain any molecules of the starting substance. Many critics use this to say that homeopathy is nothing but a placebo. And we'll talk a little bit later about some of the more recent research that tries to explain how homeopathy can indeed have an effect, even though it's diluted beyond the point where molecules supposedly exist. So some of the earliest research in homeopathy occurred in World War II when they did experiments with mustard gas, which was being used against the British soldiers. And what they did is they used a 30C, that means it's diluted 10 to the minus 100, 30 times, of mustard gas or placebo that was given prophylactically to the experimental subjects. And then they induced skin lesions experimentally with mustard gas. And they found a statistically significant decrease in deep skin lesions in those pre-treated with the homeopathic potency of mustard gas. Another important study that was done, I'm skipping to 1980, was a study on rheumatoid arthritis. And this was 46 patients received either homeopathy, classical homeopathy, so it would be individualized, or placebo, in addition to their ongoing medications for 3 months. And they found statistically significant improvements with homeopathy in the area of pain, stiffness, and grip strength. And for those of you who are unfamiliar with statistics, if a p-value is less than 0.05, that means it's less than 5 chances out of 100 that it could have occurred by chance, then that is considered statistically significant. So a p-value of 0.005 is highly significant. We move along to this study that was done in Scotland by David Taylor Riley and his group, and this was published in The Lancet, which is one of the most prestigious medical journals ever. And this really turned things around on its head, because this is the idea that a homeopathic study could be published in Lancet was really unexpected. And this was actually a study of isopathy, where you're using a highly potentized substance that can cause symptoms to treat them. This was a preparation of mixed grass pollens that were diluted to the 30C potency. Again, that's 10 to the minus 30 power, or placebo in hay fever sufferers. The patients were then instructed to complete daily diaries that contained a visual analog scale to record the severity of their symptoms. And there was a statistically significant improvement using homeopathy. In this case, they were looking at odds ratios, which again, a very quick primer in statistics. If an odds ratio does not include 0, if the confidence interval is above 0, then that means it's statistically significant. So in this case, the confidence interval was 1.17 and 4.68. So let me show you a graph of these studies. What's interesting about this study, these were the VAS scores. This was the scores that they recorded in their diaries. And for the first week of the study, it was what they call a placebo run-in period. That is, everybody in both groups, the homeopathy and placebo, were given placebo. And you can see that there's no difference in their scores. But after a week, the people that were randomized to receive homeopathy started their homeopathic treatment. And you can see that their scores went dramatically down, whereas those in the placebo group continued with scores about the same. So this was a very, very good study. I'd next like to talk about how individualization is important in homeopathic research. Because as you probably know, in allopathic studies, conventional medicines, everybody's given the same medicine, right? And that's compared to placebo. But in homeopathy, because it's individualized, it's very much more difficult to compare to placebo because the patients all have to be prescribed a specific medicine. So I think I'd like to show these two studies that show why individualization is important. This was a study that was done by Shipley on osteoarthritis in 1983. And all patients were randomized to either receive Rus tox, phenoprephin, which is like ibuprofen, it's an anti-inflammatory, or placebo. And they found a positive effect with phenoprephin compared to placebo, but no effect with homeopathy. However, the patients were not pre-screened to see if they had Rus tox symptoms. So in response to this, Dr. Peter Fisher did a study on osteoarthritis several years later, where he pre-selected the patients in his study to fit the symptoms of Rus tox. In other words, the patients with osteoarthritis that were entered into the study were only those whose symptoms fit those of Rus tox. And these were randomized then to receive homeopathy or placebo. And his results, he found statistically significant improvements in the number of tender points, in pain, and even in their sleep. And this was published in the British Medical Journal, which again, a very prestigious journal that's widely read. Another study that was done in the 80s, study on influenza using oxalococcinum, 200C. Now, oxalococcinum is sold by Boiron. It comes in those blue tubes, and many, many people take it now for flu prevention and to treat the flu. And this study is one that legitimized on a certain part the use of oxalococcinum. Oxalococcinum is made from a mixture of duck, heart, and liver, which was thought to be the reservoir of the wild influenza virus. 237 people received the homeopathic oxalococcinum, and almost an equal number got a placebo. They kept study diaries for 1 week, and they found that 17% in the homeopathic group recovered after 48 hours, compared to 10% in the placebo group, which was, again, an odds ratio that was statistically significant. I'm now going to talk about the study that I did that was published in Pediatrics in 1994. And this is the study that people know about and that I'm famous for, I guess you would say. This was a study that I did as my master's thesis, at the University of Washington. So we did this study in Nicaragua, where childhood diarrhea is very, very common. And many children in the developing world in countries like Nicaragua die of it. And so we treated children that were ages 6 months to 5 years of age who had had 3 or more unformed stools in the previous 24 hours. They had had diarrhea for no more than 1 week and had not taken any allopathic medicines, no more than 1 dose in the past 24 hours. All of the children were given oral rehydration therapy, which is the protocol of the World Health Organization. And then they were also prescribed a homeopathic medicine in the 30C potency. And the children were randomized in a way that none of us treating them knew who was receiving placebo and who was receiving active medication. And the parents were told to give the children 1 dose after each unformed stool for 5 days. We did follow-up daily at the home visits for 5 days. We gave simple cards to the parents to fill out to say how many times the child had a bowel movement, what the consistency was, etc. We prescribed homeopathic medicines individually. And you can see here that there were actually 1, 2, 3, 4, 5 homeopathic remedies that were given in more than 3/4 of the cases. No, I'm sorry. Yes, in more than 3/4 of the cases. And these are remedies that are well known to be treating diarrhea. The results that we found, p-values of less than 0.05 or close to 0.05 in those who received the treatment group. And you'll note that we had a very small sample size here. We only had 81 children in this study, 40 that received the homeopathic treatment and 41 who received the placebo. And yet all of our outcomes, the number of days until they had less than 3 stools, the days to 50% improvement, the days to first formed stools, all of these were at or near statistical significance. Now, in conventional medicine, they normally do studies with thousands of participants, thousands, 5,000, 10,000. And in those kinds of studies, you need a very, very small difference between the 2 groups in order for it to be statistically significant. But with a small number of participants, such as this was, to have a statistical significance is really amazing. And this study, as I said, was published in the journal Pediatrics, another very prestigious journal in the United States. And as I just said, pharmaceutical studies enroll thousands of subjects, and you need a lot of statistical power to detect effect size differences. But we did a meta-analysis, which I'll show you in the next slide. We followed up this study with another study that was done in Nepal. Actually, Liz Chapman and her husband, Steve Malthouse, carried out this study in collaboration with my group. And we had also done a pilot study in Nicaragua. So effect size difference is like the difference in effect between placebo and active medicine. In our pilot study, whoops, need to go back. In our pilot study, we went back too far. In our pilot study, we only had 33 subjects. In the Nicaragua study, we had 81. In the Nepal study, we had 116. And these are the p-values that we found in these. But when we combined all of these studies together for 230 subjects, then the p-value was much better. It was 0.008. So even though the effect size differences were about the same, when you increase the number of subjects in the study, the statistical significance became much greater. I would just like to mention that there have been studies that show no effect with homeopathy. There was one study of plantar warts that was treated with a combination of 3 remedies or a placebo. There was a study of pain after bilateral oral surgery. And there was another one of recurrent upper respiratory infections in children that were treated with individualized remedies. And finally, another study was done using arnica to treat marathon runners. So these are some of the studies that are used to show that homeopathy is not effective. However, if you look at these studies more closely, in terms of plantar warts, well, it's possible that the combination of these particular 3 remedies was not effective, that perhaps there was different remedy or remedies that needed to be used. The one after oral surgery, that was interesting because it was done in students at a naturopathic college. The placebo response rate in this group of people was 80%. That means that 80% of the people who were given placebo reported a positive response. And so to see a difference between the homeopathy and the placebo when there's such a high placebo response rate is very difficult. Recurrent upper respiratory infections in children, well, actually, it was almost statistically significant, but they had trouble in recruitment and they only recruited half of their intended subjects. And finally, arnica for marathon runners. Well, arnica is for bruising and swelling after blows or falls. It's not for aching muscles, which is what the marathon runners had. There was a meta-analysis done in 1997 that showed out of 89 controlled trials that had adequate information that the combined odds ratio was very high in favor of homeopathy. And people said one of the criticisms of this and other studies is, well, people only report the studies that are positive. The studies that are negative, people just kind of put away in their drawers and they don't report them. Well, the authors of this study calculated that in order to show a pooled effect size of less than 0.05, there would have to be 923 missing trials that had an odds ratio of 1, meaning there was no difference between homeopathy and placebo. The Shang meta-analysis is often used to delegitimize homeopathy, even to this day, even though it was almost 20 years ago. In the Shang meta-analysis, they looked at 110 homeopathic and 110 conventional studies, but only 8 of the homeopathic and 6 of the conventional were included in the conclusion. 13 high-quality homeopathic trials, including the Nicaragua and Nepal diarrhea studies, were excluded because they said they were small. I mean, I've never heard a complaint that a study was too small. As I said before, if a study is small and it's significant, that's actually more positive results. but they excluded all of the small trials. And of course, there's not much money available for homeopathic research, so many of the trials are small. Finally, all the homeopathic trials that they included were non-individualized, including the study of arnica in runners. And yet this meta-analysis is used even to this day to disprove homeopathy. Finally, I will stop boring you with meta-analyses to mention this one that was published in 2014, which looked at the best quality randomized controlled trials of individualized homeopathy. They found 32 trials of 24 medical conditions, and 22 of them were analyzable. That is, they had enough information in them to do the analysis that these people wanted to do. And they found the 95 confidence interval combined of all of these studies was 1.22 to 1.91. When they looked at the three most reliable trials, the odds ratio was 1.98 or almost 2, which means in lay terms that the homeopathy was twice as effective as placebo. As of August 2017, there had been 1,137 clinical trials of homeopathy. Over half of them were homeopathy versus placebo. Several others were versus standard treatment. 2 studies found that homeopathy was at least as effective as Prozac for depression. Out of all of these studies, 41% were positive, 54% inconclusive, and 5% negative. And when the authors of this study looked at reviews of conventional medicine studies, they found similar numbers, 44% positive, 49% inconclusive, and 7% negative. So the homeopathic research literature really is comparable to that of conventional medicine. I'd like to just, in closing, talk about a couple of more recent trials that have been very impressive. This was a study of patients with non-small cell lung cancer. These were patients who were terminally ill. There were 150 patients, and one group was called the add-on homeopathy group. They were given standard care plus a homeopathic consultation plus a homeopathic prescription. The placebo group was given standard care plus a homeopathic consultation plus a placebo. And the observed control group received standard care only. Now, why did they include this group that had standard care plus a consultation plus placebo? Well, many critics of homeopathy say that people get better because we give them so much care, because we're empathetic, we spend an hour and a half listening to their story, they feel a sense of being heard. There's often a catharsis of emotion as they go through talking about themselves and all of the things that are included in a homeopathic consultation. And so many people argue that, well, that's why people get better from homeopathy, is because of the therapeutic effect of the homeopathic consultation. So in this case, they did include the homeopathic consultation, but these people just received placebo. The results: the add-on homeopathy improved the quality of life, highly significant, and the median survival time. compared to placebo. I think that I have the numbers written down somewhere else, but those who received the add-on homeopathy, they lived an average of 400 and some days after their treatment, whereas those who received standard care only lived only 200 and some days. So it was quite striking, the effect of homeopathy in these patients. And it really helped them live longer as well as improve their quality of life. Another recent study was on post-mastectomy healing. This was a double-blind randomized prevention study, and it was non-individualized. That is, all of the patients were given the same medication, but the medication were somewhat individualized to their condition. There were 55 patients who had combined mastectomy and breast reconstruction, with 78 breasts involved. And they were given a combination of arnica montana and Bellis perennis, which are both homeopathic remedies that help in recovery from surgery, or a placebo. And the treatment was given from the time of surgery until the drains were removed. And they found that the homeopathic treatment reduced seroma formation. Seroma is like a buildup of fluid in the breast. And the drains were removed almost 2.5 days earlier in the homeopathic group than in the placebo group. Okay, I'm going to skip this because we're running short. Okay, now another type of research that's very important is comparative effectiveness. And this was a study called the EPI-3 study that was done in France, looking at the effectiveness of people treated with homeopathy versus those treated with conventional medicine. There were over 6,000 patients from over 800 medical practices, and they were comparing conventional medicine practitioners, mixed practitioners who use conventional and homeopathy, and homeopathic. And they looked at 4 different cohorts: musculoskeletal disease, upper respiratory tract infections, sleep disorders, anxiety, and depression. And they were looking at several outcomes. They were looking at clinical benefits, medications, adverse effects, and the economic benefits. So I'm just going to show one cohort. Well, 2 actually. So this is the musculoskeletal cohort. Patients did not differ, except for the homeopathic cohort actually had problems for longer. And they all had similar clinical progression. However, the use of non-steroidal anti-inflammatory drugs were almost half as much in the homeopathy group. And this, they thought, had considerable impact on population health and healthcare costs, as well as side effects, because the non-steroidal anti-inflammatories have many, many side effects that over half the patients were able to avoid using homeopathy and having the same results as those who were taking the conventional medicine. As far as upper respiratory tract infections, I'm going to go on. There were 518 that had upper respiratory tract infections. The homeopathic patients took half as many antibiotics. They took less anti-inflammatory drugs, and they had a similar evolution. That means they they got better in the same amount of time as the patients who took antibiotics or anti-inflammatory drugs with fewer side effects and less cost. So the conclusion of the cost effectiveness study was that the homeopathic doctors prescribed far fewer drugs, which you would expect, at 20% less cost per patient, which they thought was of great importance to public health. An interesting study on veterinary research was done by a Dr. Ellinger in the Netherlands. She was looking at homeopathy as a replacement to antibiotics in the case of E. coli diarrhea in piglets. So apparently many piglets are born with E. coli infections. In this study, 26 pregnant sows were randomized to homeopathy or placebo, and those in the homeopathy group were given potentized E. coli weekly for a month. After the piglets were born, 63 out of the 200 piglets had diarrhea who received the placebo, whose mothers, the sows, had received placebo. Only 10 of those whose pregnant sows had received homeopathy had diarrhea. And within the litters themselves, the litters could have up to 10 piglets. There were many in each litter with placebo, but maybe only one in the litters where the mothers had received placebo. And of course, everyone was blinded, the farmer, the statistician, even the sows. Okay, I'm just going to give you a very quick overview on biological research on high dilutions. And this, of course, could be a whole presentation in itself. But there's been a lot of basic science research looking at homeopathy in the laboratory, in test tubes, on laboratory animals. And these are some of the studies where they've used high dilution homeopathic potencies in biological models using silica, looking at macrophages in mice, looking at arsenic in rats, aspirin and bleeding time, human basophil degranulation, and thyroxine and climbing behavior of frogs. All of these studies showed significant differences between homeopathy and placebo. The study on thyroxine and climbing behavior of frogs I thought was particularly interesting. They had 2 aquariums where they had frogs, and one they added a 30C potency of thyroxine, and the other just a placebo. And then they measured how quickly the frogs went from being tadpoles to starting to climb. And they found significantly difference with those who received the homeopathic potency, even though it was diluted 10 to the minus 30th power, way beyond Avogadro's number. As of August 2017, there had been over 2,000 biological experiments in homeopathy in animals, plants, human tissues, bacteria, and viruses. And 55% were what they call ultramolecular, which means it's beyond Avogadro's number. And 90% of the ultramolecular dilution showed at least one positive response. Of course, people argue, well, it's just one study. The real gold standard in research is if a study can be replicated. That is, if it can be repeated in a different laboratory by a different group of scientists, then that gives it more legitimacy than if it's just done by one group. So there was a review of 126 replicated biochemical and biological studies. And it was the null hypothesis was that there would be no difference shown in the repetition. And this was refuted. 70% of the experiments were able to replicate the previous studies. So this is pretty amazing. Okay, in summary, I'd just like to say that there's a long history of clinical and biological research in homeopathy. And the research confirms that homeopathic medicines have an effect that's different than that of a placebo. However, as in any field, especially in homeopathy, more research is definitely needed. Okay, that's the end, and I'm sure you might have some questions.
Thank you so much, Jennifer. That was a wonderful presentation. Thank you for the time that you took to put all this together. So the floor is open to questions. There are a few questions already on the question and answer. Please feel free to answer the one that you like, because some of them may not be about your topic necessarily. It may be other questions. But the first question I have here is, how much repertorization do you do at this point in your casework, since you know by experience the remedy pictures and proving very well by now?
Oh, always repertorization. You never know enough to go without repertorization.
Perfect, thank you. So the next question is, what is your professional instructions for people with cancer who come to try homeopathy for either chemotherapy, radiation side effects, or for boosting immunity to take care of their own malignancy?
Well, I'm afraid I can't answer that question. That's outside the scope of my expertise.
Next question is, I would like to know about your learning on your past homeopathy research experience with respect to the results, methodology, study design, what needs to be changed, improved in the future studies?
Well, the main thing I think that needs to be improved in homeopathic studies is having more funding so that the studies can be larger and more likely to produce positive effects.
Would you please comment on the recent RAND study on state of homeopathic research, clinical, and maybe the June study on guidelines before basic researches, if you have time?
Well, as far as the RAND study goes, it was commissioned by a foundation that supports homeopathy in order to determine what areas of research should be emphasized. Unfortunately, it only looked at studies since, I think, 2013. So a lot of the earlier studies were not included. And the panelists who did the evaluations of the research studies were not happy with the conclusions that were drawn by the RAND people. There was quite a bit of controversy over the conclusions, which were that there was a lot of deficiency in a lot of the homeopathic studies. And again, I think this is due to lack of funding for homeopathic studies. They're often done on a shoestring, and they don't have the support of research companies that do this all the time. It's very unfortunate, though, that it came out with the conclusions that it did. As far as the other one you mentioned, I'm not familiar with that.
Thank you. What do you know is the difference between the placebo response and the homeopathic response?
Well, I think that's a question that you should answer, Dr.
Sure.
It sounds like you gave a seminar on that. Yes,
and I really want to invite whoever has asked this question to listen to that lecture that I gave in June. So in very short, there are two things that are really important for us to know. When a patient comes to see us as homeopaths, I can give an example of a 22-year-old patient with very severe migraine headaches. His headaches had started with just very regular headaches and then gradually got worse and worse and developed into migraine headaches. He had gone from Tylenol, Advil to taking Furanol, Imitrex, Zomig, and all of them would work for a short period of time and then stop working. When I saw him, he was taking one of the opioids to control his pain at 70%. So he was really at the end of his hope. And I spent 2 sessions with him and gave him a homeopathic remedy, zinc sulfate. And within 2 months, his migraines had vanished completely. He went back to his doctors and told them what happened with the homeopathic remedies. And the doctor says, well, homeopathy is placebo. It looks like placebo worked for you. I think what is the reason I share that is because it's very important for all of us to know that when you give Tylenol to a patient, you give it because Tylenol is far superior to placebo. Advil is superior, Zomig is superior, Imitrex is superior, Toradol is superior. If any of those were supposed to have a placebo effect on the patient, you would expect for the patient to respond to those drugs that are superior to placebo. So for a patient to come and see a homeopath and have such an amazing response to say that this is a placebo response, it's really for the doctor to hide behind the placebo and not to recognize that if placebo was supposed to help this person, why none of the other drugs that are superior to placebo would? So that's one component that I emphasized on my presentation. The other component was that when I have patients who come and have improved and they ask me, how do I know this is not a placebo response? There is a way to test it, and I explained this in that research. One example I used was a medical doctor who had responded really nicely to a remedy for his allergies, and then he asked me the same question. So I asked my receptionist to use 7 different bottles without me knowing or the doctor, the patient knowing which one is what, and put the homeopathic remedy in 2 of them randomly and put nothing in the other 5. So he had two remedies, 2 bottles that were remedies and 5 were placebo, and asked the patient to take each one for once a day for a week, and if he thinks it is placebo, to move on to the next one. If it is a remedy, wait until the effect goes away, take another dose, and once he knows that it is not a placebo, he moves on to the next one. So I saw these patients close to 10 weeks, 12 weeks later, and he came and said that only 2 of them had an effect. And the 2 that he mentioned were bottle number 2 and 5. So I asked my receptionist to come in and to show us in which order she had put the homeopathic remedies and the placebo. And to his surprise, my surprise, and her surprise, bottle number 2 and 5 were the homeopathic remedies, and the other 5 bottles were placebo. So, and I have done this with various numbers of bottles. Anytime you question whether a remedy is acting as a healing agent or a placebo, you can test that remedy by giving 4 or 5 bottles of placebo and 1 homeopathic remedy. Of course, the more numbers of bottles you give, the more you reduce the chances of the statistically for it not to be significant. But I have gone through that in depth during that presentation, and I showed that the chances that this could have been just a per chance is 1 in 5,000, and that's a very, very highly statistically significant that can be done 1 person at a time. But the other thing that's really important also is to know when I give a homeopathic remedy, if a patient just came and said, my headache is better, that could be a placebo. But when a patient comes and say, I have never slept this good, my energy has improved so much, my memory is much sharper, my shoulder pain is gone, my constipation is better, and so on, and you go through the list of all the symptoms, then you see that the remedy has affected the totality of the person. You will almost never see that kind of response in the placebo-controlled group. So those are all different ways that homeopaths have, and homeopaths use placebo in their practice anytime they don't want a remedy to repeat a remedy too frequently, or if they want to rule out the placebo, they can just give placebo to the patient and see how it works. So we have a very solid method to rule out placebo anytime we need. So the next question is, how individual homeopathic clinical trials are conducted with the study design of double-blind RCTs? Because for individualized medicine, we need to know patient case taking, the detail and chances of double-blind are less to be rational.
Yes, that's a very, very good question. Because of individualization, it's much more difficult to randomize patients with homeopathy. In some of my previous studies, what we did was we had, for all of the remedies that we considered to be possible, like, for example, in diarrhea study, we had 20 different remedies that we thought might be prescribed for diarrhea. So for each one of these 20 remedies, we had a box of vials, half of which were placebo and half of which were the actual homeopathic remedy. So when a particular patient was prescribed a remedy, we would go to that box and we would take the vial out in order. They were randomized in a particular order and give that to the patient. And so for each of the 20 remedies, we had randomized medicine. The other way, yeah, but individualization makes very difficult doing homeopathic double-blind placebo-controlled trials. It's difficult for the prescribers because, for example, if you're doing a study over 6 months or a year, we did a study on hot flashes in breast cancer survivors, and it went on for a year, and the patients were being seen every 2 months by the practitioners, and they were given either placebo or active medicine through the whole year. Well, when the patient came back and they weren't any better, the provider didn't know, was it the wrong remedy or did the patient get a placebo? And so it's almost like you're practicing with your hands tied behind your back. We told them, you just have to assume that they're getting active medicine. And if they're not getting better, if you want to change remedies, go ahead and change remedies. But it's very difficult to conduct individualized treatment during a double-blind randomized controlled trial.
Over a long period of time.
Yeah. Over a long period of time, yes.
Thank you.
I mean, something like the Nicaragua diarrhea study, we were only treating her for 5 days, so it wasn't a big
Much
deal.
easier, yes.
And patients also, you know, if they're going into a study for a year and they think that they might get a placebo for a whole year, it's very difficult to recruit people in those conditions.
So the next question is, thank you so much, Jennifer. The next question is research done in India can be useful in North America, or will those studies somehow are not valid here or valid here? Does it make a difference where you do the research?
No, the studies that they do in India are very valid all over the world because they're doing studies on common conditions. The journal Homeopathy, which comes out of England, it's this is where you'll find all the research that is published in India, in Brazil, in Europe, all over the world. It comes out quarterly, and it's a very good journal. So I think you could probably Google it. It's the Journal of the Faculty of Homeopathy in Great Britain, Homeopathy. And this is where you'll find the Indian studies and all of the other ones.
Perfect. Looks like that's all the
Oh, one other thing, one other resource is the Homeopathic Research Institute, the HRI, Homeopathic Research Institute, also in Great Britain. And they have a marvelous website with many references. And I think maybe Liz can go ahead and put that up in the chat too, the link to them. But those two resources are wonderful for keeping track of the latest homeopathic research.
That's very, I'm really happy that you mentioned that HRI website is a really wonderful resource for anybody who is interested in homeopathic research. Maybe I can just address very shortly this other questions that was about what is your professional instruction for people with cancer who come to try homeopathy for either chemotherapy or radiation side effects or for boosting immunity to take care of their own malignancy? So we saw a research that patients had cancer and they used homeopathy alongside the conventional therapy, and you saw that the longevity has almost doubled in the homeopathic group. So we have all the reasons to include homeopathic remedies for in everyone, whether they do chemo and radiation together or alone, or if they choose not to. Homeopathic remedies in all of those cases, if it's done properly, is really beneficial for the well-being of the patient. Sometimes it can reverse the pathology, but at least it will improve the quality of the life of the patient. If there was any other question. So it looks like that's what it is. Thank you so much, Jennifer. That was so lovely to have you here. Thank you for taking time to be with us. I want to invite Victor and Liz, if you have any closing remarks.
Jennifer, thank you so much. Do you have any thoughts about the state of homeopathy and where you think we're going in the next few years? I know that we chatted briefly at the beginning about the FDA clamping down, and certainly in Canada we have Health Canada, who is also trying to limit the manufacturers and also access to remedies and so on. Any thoughts about that?
Well, it's a very challenging time for homeopathy. And I can only say that there are people working daily trying to keep up the work and keep the FDA involved. It's a challenging time, and it can be very discouraging for those of us who've been working in homeopathy for many, many, many years. But you have to have faith that, the truth will come out, and the number of people using homeopathy, the patients, the grassroots support is there, and hopefully we will get leaders who are able to see that and support homeopathy. But the pharmaceutical industry is so powerful, and for some reason they don't like homeopathy. I don't understand. Homeopathy is such a small bit of the healthcare dollar. Why they would work so hard to do away with it, I don't understand.
Thank you.
I'd like to add that the fact that homeopathy is now regulated in Ontario is a very positive thing for homeopathy. And the chance that it may become regulated in Alberta or be even considered for insurance coverage is a very good sign. So at the same time that there are attacks on homeopathy, homeopathy is continuing to grow and expand and become more and more accepted.
Yes, absolutely. And since its inception, there have essentially been attacks against homeopathy, and it's survived and it's thrived. And we still have many new practitioners and many new patients and many miraculous, successful treatments of a wide range of pathologies. So homeopathy is not going to go anywhere, and it's always faced opposition, but ultimately, it's here to stay. So yeah,
That's
that's
true.
yeah. Um, Good. So, thank you to all of you who have attended tonight. And I just want to share a few um, reminders, but and also thank yous. So, first, I want to say thank you to Canadians for Homeopathy, which is not the same organization as the Canadian Coalition for Homeopathy. Um, Canadians for Homeopathy have allowed us to use their Zoom account for these webinars, and we want to thank them very much for that. But also to alert all of you to the existence of this group, which is a consumer organization, and you can visit their website, canadiansforhomeopathy.com, to find out more about their initiatives, to sign up for their newsletter. And they also offer webinars, mostly on a monthly basis. The next one is advertised here on headaches. And again, they are more of a consumer organization. And yeah, you can find out more about their mission by visiting their website. And since we're here on the web, I'll show you again the Canadian Coalition for Homeopathy website, who are putting on these research webinars. And we spoke about the coalition at the beginning. You can visit our website for more information, to stay in touch with us, to join our newsletter. As you can see, a mailing list is now open. And if you enjoyed the webinar and have any interest in supporting the activities of the coalition, which will extend much beyond webinars, though that is a current focus, we're advocating for the growth and development of homeopathy in Canada, and of the well-being of practitioners and patients, to see the profession grow and to see research grow and developments in homeopathy. You can donate whatever is in your means to do so, to help the coalition in their work. And lastly, I will bring up again the next webinars in the series. November 20th, Arya Mohan will be presenting, topic to be determined. In January, we have a presentation on agrohomeopathy by Dr. Fado from Brazil. A very exciting field of study. And then in March, we have Ronald Whitmont, who is presenting research on homeopathy in pain. So to register for these webinars, when the registration opens, you can visit our website, sign up to our newsletter, and you will be kept up to date about all of these webinars and be able to register for them when that is live. And with that said, thank you everybody for being here today. The recording will be posted within the next couple of days, so please do share it. If you're a practitioner, share to your patients, to allied health professionals, anyone who is curious or skeptical about homeopathy, who would like to learn more. That's what these webinars are for, to help educate and inform, and to show that there is a very exciting and very important research that's being done in the field of homeopathic medicine. So please do stay in touch, and thank you all for being here.
Thank you, Victor. Thank you, Liz. Good night, everyone.
Thanks. Good night.